The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health education purposes only and complies with all HIPAA regulations. All of the CDC guidelines for COVID-19 safety were followed while filming this episode of the Dr. Fazil Show.
Good afternoon and welcome to the August 2021 episode of the Dr. Fazil Show. We have award-winning Dr. Fazil here with us, and we're in the trenches of the Delta variant COVID war.
Thank you, audience, for having me on this show today. As we know, we are in the deep fight against the Delta virus, which is a new strain of the COVID-19. Now, there's some controversy at this time that if it is a new strain or it's a new virus. And we're going to talk about that. In essence, it is behaving like a new virus. It has 3 mutations and it is causing a totally different pattern of epidemiology. It is affecting a lot more of children. It is affecting vaccinated people as well as unvaccinated people. But obviously it's not making vaccinated people sick as much as it is making unvaccinated people sick. So there's a still role of vaccine in the prevention of Delta virus. But there's some major differences between the first version that we saw last year in 2020 versus the Delta version in 2021. And we're going to talk about that. Also, there's a new version coming up known as Lambda virus, and we have seen some opportunistic infections, like in Texas, about the fungus like Candida auris, which is normally not harmful to the human being, but people who have cancer or immunosuppression, or people who have lately we have found that people who have been affected by COVID-19 and are recovering from COVID-19 infection, they are also being affected by those rare opportunistic infections like those fungal infections. Now in India, we talked last episode that they are being affected by another kind of fungal infection known as black mold. So this is kind of equivalent of black mold in Texas, Candida auris fungal infection.
And Dr. Fazil, are we in the herd immunity level yet here in the U.S.?
Well, that's a good question. The herd immunity is when you have, people who are not vaccinated, they get immunity from people who have been vaccinated. Normally, the threshold for that is 75% or more. We are almost there, but strangely, we have not seen the herd immunity effect yet. I think there's a difference in our mathematics. The herd immunity would have been if we would have the same variant like the one we had last year. Since we have now Delta version as a major virus in the USA, affecting a major population. Since the virus is new, the vaccine which was effective against the previous version is not applying to Delta virus. So I think we are not at the level of the herd immunity at this moment.
And Dr. Fazil, why do we still have to continue to use our masks when so many people are vaccinated already?
Well, the reason is that initially CDC said after a certain number of people have got vaccinated in USA, we were safe. But again, this virus is mutated fast. We don't know, we didn't know at the time how it's going to react. It was found out later that people who are vaccinated are still hosting this virus. So that means they can still affect those people who are unvaccinated. Although people who have been vaccinated are not getting that much symptoms, or they're not getting sick enough to go to the hospital, or even if they go to the hospital, they still are not that sick. Obviously, that's the benefit of having vaccine. But at the same time, Delta virus is so strong that it is 6 to 9 times more contagious than the previous version, and it is also more effective, more deadly than the previous version. But also we have found that it is also using the vaccinated people as a host. So that is a concerning factor right there, because it's a very much possibility that it might become a new strain from Delta version, which might be resistant to the vaccine we are already giving to the patients. If that happens, we will have to start all over again. So the best thing is, as in any epidemic in the past, that isolation and prevention of droplet infection by the mask, as well as hygiene, cleaning the hands, and stuff like that. That will at least prevent people who are not vaccinated yet to spread the infection to those people. So yes, people who are vaccinated are probably protected to some extent, but they're also carrying this virus in their body. And then they are becoming a host for this virus, and they're able to transfer this infection to people who are not vaccinated. So that's why the CDC reversed the guidelines to go ahead and start using the mask. I think it's a good practice at this time to keep using the mask. Obviously, good hygiene is important. Sanitizing your hands is beneficial for any kind of, to prevent any kind of infectious disease. So that's the current situation as we speak.
Dr. Fazil, what do you see in the horizon coming up?
So I have a concern that the way this virus is affecting young people, young adults this time, even children, and they are being hospitalized. My concern is that if this virus mutates, which is a high possibility, then it might start to cause more casualties as it did last time. And if that happens, there might be another lockdown, which would be very, very bad, because as we know, the lockdowns are not good for financial reasons and for economy. But if that need to be done, then it need to be done. We'll see how it goes there, but that's the ticking time bomb at this time. You know, if it mutates one more time and it becomes resistant to the vaccine, then it will be absolutely just like a brand new virus, a brand new pandemic. That would be very, very concerning. That's what I see on the horizon at this time.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Fazil, in your opinion, is this the worst pandemic for mankind?
Well, as far as we know, in the last few hundred years, this is not the worst pandemic as far as the casualties are concerned. The Spanish flu was the worst pandemic. I mean, if you have to look at the number of the casualties, the number of casualties back then was 100 million people died in the Spanish flu. And if you look at the people who have died in First World War and Second World War, if you combine them together, it is more than those two big wars. The casualties in those two wars were less than what we had casualty from the Spanish flu. So that was by far the most fatal pandemic in the known mankind history. But we don't know about this pandemic at this time, which direction it is heading towards. So I think we know the Spanish flu, it took it 3 years to go away. So, but at that time, the technology was not that advanced. So hopefully we will be over on this pandemic if people follow the guidelines and everybody get vaccinated, and we get over this epidemic or pandemic as soon as possible, so we can go back to our usual business. But again, we thought it was over, but it was not. It came right back because of the long weekends where people start to socialize more and put the safeguards away, and the virus started to spread. And the Delta virus got spread from India, and it, as you know, it is as effective as the chicken pox. And chicken pox was one of the most contagious infection in the history of mankind. It has the same kind of contagiousness, and that's why it got spread so fast. And now, since we already have this virus, if it mutates again, then if it mutates in the direction where it is not, it bypasses the immune mechanism, which protects against this virus through the vaccines, then our vaccine will be totally ineffective, and that means we have to start from day zero, and that would be a big catastrophe for the mankind. Man, that was close.
Wow.
You heard?
No, I'm all right. I'm all right.
That was close one. Seems like Delta virus is getting close one.
Yeah.
You know,
I'm gonna have to
you need to
strengthen our forces.
strengthen the force. Yeah. Need to improve our safeguards.
There you go. Yeah.
Need to
Keep our safeguards up.
keep our safeguards up. Audience, keep our safeguards up. It was close call.
And Dr. Fazil, how many cases are recorded of the Delta virus in the U.S.?
The Delta virus has been reported about 100 million people has been affected. About 100 million people have been affected by Delta virus in last 6 months alone. Now remember, when the COVID-19 started in 2020, it took a year for COVID-19 to get up to 100 million people to be infected. It took only 6 months or less than 6 months for this Delta virus to affect 100 million people. It's still spreading like a wildfire. So that shows this is very contagious, and we have to be very, very careful.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
And Dr. Fazil, is there any role for the booster shot to prevent Delta virus?
At this moment, there's no studies available to say yes or no in any direction. We don't even know if you need a booster shot for the COVID-19 which started from last year. So as the studies get completed, we will have better answer that should we get a booster shot or not. We know that we need 2 shots, either Moderna or Pfizer, but the third shot, we are not sure about that at this moment. And also, we are not sure about that we should get a Delta-specific vaccine. I know there's companies like Pfizer and Moderna is working on Delta-specific vaccine as well. If that happens, then we will, people who have been vaccinated in the past with 1 or 2 doses or even 2 doses, they would need to have another vaccine, which might not be a Delta, which might not be considered as a booster shot, but just the the Delta vaccine. And we are not even sure that if it's going to be 1 shot or 2 shots. So everything's up in the air. This is a very nasty, dangerous, and very new virus we have ever seen in our history of the mankind. So everything is fluid at this time. We are in uncharted territory, and we have to go as day by day. This virus is evolving, just like in a combat. As the enemy evolves and changes its strategy, we have to change our strategy just like that.
And Dr. Fazil, there's so much false information out there. What would be the right source to get your information about the Delta virus and vaccines?
Well, I think the CDC website it has a lot of valid information, but at this point, since there's a lot of hesitancy for getting vaccine from some patients, and it's rightly so, because I know traditionally the vaccine takes a longer duration of time to be studied before they get implemented. People get inoculated, but we don't have time. We didn't have time for that. But even with that note, the people, there was around 70,000 people involved in the first study. That's a huge amount of patients which was studied for the safety of COVID-19 vaccine. So the second source would be your primary care doctor, because the primary care doctor has best interest for their patients. They stay updated from the medical resources about this pandemic. So I think patients should trust their primary care doctor and ask them if the vaccine is right for them or not. I mean, in certain cases, yes, it might not be the right choice. For example, if they're immunocompromised or if they're allergic to the vaccine, in that case, that's a different situation. But most cases, it's pretty safe. As I said, people will have side effects, and if you use any medication or vaccine in such a large scale, you do expect side effects. So, but they're very minimal. I know there are some side effects which has been fatal, but again, if you look at the percentage of people who got it, is very minimal, and it is just nature of the beast. We give medication, even if you give Tylenol to the whole world, some people will have allergic reaction to that, liver failure and stuff like that. So there's no perfect cure or no perfect prevention, but this is the best thing we got at this time, the vaccination and obviously the mask and hand sanitization. So that's why we started this channel to people can watch and read about the healthcare conditions, which might be different. This time is COVID-19 pandemic, and then once the COVID-19 pandemic cools down, I would be talking about different topics as I had talked in the past. Idea about Dr. Fazil TV show through Health Tips Media is to educate the patient, and so they get the information directly from the doctors or from the doctor, even if they're not my patients, for general public. So we have taken the misinformation out of the information part. Misinformation is very dangerous. It's more dangerous than sometimes pandemic by itself. Misinformation has been used in the previous wars as a propaganda machines to overcome the enemy. So we have to be very careful because misinformation, which is mostly given through the social media channels, internet, and other resources, could be more dangerous than the pandemic by itself. So remember that misinformation has been used by enemy forces in the past to win the battles in various fashions. And so sometimes, the public does not know the facts. Sometimes they're being told that pandemic is not bad enough, and it just prevents massive hysteria. Sometimes, misinformation has been given by the unknown entities that, vaccine is bad, so don't take the vaccine. So I'm just saying, use your common sense, use the CDC as your resource, ask your primary care doctor. That's the best resource for non-biased information, because the primary care has best interest of yours in his mind. So that's my message to the audience today, to stay educated, avoid misinformation. Misinformation could be more fatal than pandemic by itself. Things which you don't know can kill you. Have a nice day. God bless you all.
Thank you for being with us for today's episode. Stay tuned for our September episode of the Dr. Fazil Show. God bless.